Hi, I'm Dr. Bud Holcomb, and this is Psychiatry for the People. I've been a practicing psychiatrist in Austin, Texas for 20 years. Today I'd like to talk about alcoholism and treatment. Drinking alcohol through wine can be traced back to the earliest forms of human civilization. It's ubiquitous and prevalent in every culture. 88,000 Americans die each year from causes directly tied to alcohol use. This does not include the 50% of traffic fatalities that involve drunk driving. About 1 out of 12 people in the U.S. drinks too much. The body hates alcohol. When it is metabolized in our bodies, the first breakdown product is acetaldehyde, or paint thinner. Many people say, but I heard that a little bit of alcohol is good for blood pressure. No, a mild amount of wine may be part of a heart-healthy diet, but excess alcohol causes high blood pressure, heart disease, stroke, liver disease, and digestive problems. It causes neurodegeneration in the brain, especially in the hippocampus and the prefrontal cortex. About 7% of all cancer deaths can be attributed directly to alcohol use. So what is too much? Many people tell themselves they don't drink too much because they are still able to hold a job. No alcohol is definitely the most healthy. However, experts estimate that 8 to 10 drinks per week is an acceptable risk for women, and 10 to 12 drinks per week is an acceptable risk for men. Women have a higher percentage of body fat and so store alcohol longer, which is why it's recommended that they drink less. What is a drink? 12 ounces of beer, 5% alcohol volume. Nowadays, microbrews and craft beers are higher alcohol content. An 8-ounce glass of wine, a bottle of wine is 4.5 glasses, and a shot is 1.5 ounces of 80 proof liquor. People lie to themselves all the time. I only have 2 drinks a night, but their drink has 3 shots of vodka. Or, I drink 10 beers a week, but those beers are 16 ounces and 7% alcohol content. 8 to 10 per week for women and 12 to 14 per week for men is considered not unhealthy. For non-drinkers, that seems like a huge amount. That's like getting drunk 3 times a week. Alcohol is a very addicting drug. Drugs of abuse that are addicting have in common that they act on the brain very quickly and cause a strong release of dopamine. This is true for alcohol, nicotine, opioids, amphetamines, cocaine. With these drugs, we chase the buzz or try to get more and more dopamine. 1 is too many and 1,000's not enough. Every smoker knows that they smoke more when they drink and vice versa. I like the saying that the opposite of addiction is not sobriety, but connectedness. The one thing that we cannot tolerate is loneliness. Most people started drinking when they were young because it was something to do with friends. Now, alcohol is at the center of all our social gatherings. People fear that if I were to quit drinking, I'd be boring or I wouldn't have any friends. I'd be lonely. The joke is, I tried rehab, but it was killing my social life. However, not everyone who is sober is boring or lonely. It's helpful to have someone you admire who is not alcoholic. For me, that would be people like Willie Nelson, Barack and Michelle Obama, David Letterman, Jerry Seinfeld. They seem to have plenty of fun and are so healthy for being sober. Thanks for watching.